Keir Starmer, the leader of the UK's Labour Party, recently delivered a major speech addressing the future of NHS England. While some headlines may suggest dramatic changes, Starmer's focus remains on reforming and strengthening the healthcare system rather than abolishing it. In this article, we'll break down his speech, explore the key points of his proposed policies, and discuss what this means for the future of public healthcare in the UK. Starmer's stance on the NHS. What did he actually say? In his speech, Starmer reaffirmed Labour's commitment to the National Health Service, calling it the bedrock of British society. However, he also acknowledged the serious challenges facing the NHS, including record waiting times, staff shortages, and underfunding. Rather than abolishing NHS England, Starmer emphasised the need for bold and radical reform to ensure its sustainability. He argued that without significant changes, the NHS could become increasingly ineffective, failing to meet the needs of the public. Key takeaways from Starmer's speech include: cutting waiting times. Starmer proposed a plan to reduce NHS waiting times by increasing the number of appointments and streamlining administrative processes. More NHS staff. He pledged to recruit thousands of new doctors, nurses, and support staff to tackle workforce shortages. Better use of technology. Starmer highlighted the importance of modernizing NHS systems, using digital solutions to improve efficiency. Tackling the social care crisis. He stressed that fixing the NHS also requires addressing social care, ensuring elderly and disabled patients receive proper support. The debate: can the NHS be saved without radical change? Starmer's speech has sparked debate among politicians, healthcare professionals, and the public. Some argue that reform is long overdue, while others worry about potential privatization or loss of free healthcare services. Supporters of Starmer's plan say the NHS is struggling under its current structure, and without reform, it could collapse. Investing in technology and staffing will make the system more efficient. Labour's proposals will help patients receive treatment faster and improve working conditions for healthcare professionals. Critics argue that any changes could open the door to privatization, reducing the NHS's role as a publicly funded service. More details are needed on how Labour would fund its reforms. The real issue is underfunding, and restructuring alone won't solve the crisis. What would reform look like in practice? Starmer has not provided a fully detailed blueprint, but his speech suggests that Labour's reforms would focus on making the NHS more sustainable while keeping it free at the point of use. Possible changes could include shifting to preventative care, encouraging early interventions to reduce hospital admissions. Better coordination between services, ensuring NHS hospitals, GP surgeries, and social care providers work together more effectively. Reducing bureaucracy, cutting unnecessary red tape so medical professionals can focus on patient care. Labour has also hinted at exploring public-private partnerships, but Starmer insists that core NHS services will remain publicly owned and funded. Public reaction. What do people think? Starmer's speech has drawn mixed reactions from the public. Some voters appreciate his focus on fixing the NHS but remain sceptical about how Labour will deliver these promises. Others are concerned that reform could mean cuts or increased reliance on private providers. Healthcare unions and professional bodies have welcomed discussions about increasing NHS funding and staff recruitment but are waiting for more concrete policy details. On social media, the debate is lively, with some praising Starmer's pragmatic approach while others fear that change could mean the NHS moving away from its founding principles. Conclusion: a turning point for NHS England? Keir Starmer's speech signals that Labour sees the NHS as a top priority, but the details of his reform plan will be crucial in winning public trust. The key question remains: can Labour balance modernising the NHS while preserving its core mission of providing free healthcare for all? As the next general election approaches, voters will be looking for clear policies and funding commitments to ensure the NHS remains a strong and effective institution. What do you think? Do you believe the NHS needs radical reform, or should it be improved within its current structure? Let us know your thoughts in the comments. If you found this discussion helpful, don't forget to like, subscribe, and turn on notifications to stay updated on the latest political news.